G'day guys, welcome to the level 3 knee exercise video, which is more focused on advanced functional movements. Previously we've done the muscle activation stuff, which is your base level exercise groups, and then we get into more functional movement patterns. And now this is a bit more advanced stuff, which is more sport specific. So your therapist will be able to sort of guide you a bit closer with the exact movements we want to do, but we're just going to go through some of the generic things that are going to be incorporated within this level of exercise. With this, you would need a couple of pieces of equipment. Obviously, one of those is being a step. Now, it doesn't have to be a step like what we've got here. They can be a set of stairs or any sort of gutter or something like that near your home or around your house or in the backyard that we can actually use as a bit of a piece of equipment to do this. And then ideally we also might use a BOSU, which often many gyms will have a BOSU. If not, you can pick them up for quite a reasonable price from various suppliers. So the first exercise we want to go through is what we call a step jump. Okay, now we've done a lot of squats and things like that to get ourselves to this point where we're quite strong and we're quite controlled and we understand what our knee movements need to be like. With this one here, you can see I've got varying size steps here, so I'll start with the small one and then we'll go from there. So the first one is like a bilateral or a two-legged landing from a step, okay? Now this helps us in terms of being able to control our movements, great after an injury for rehabilitation. So as we land down, you notice I'm going to jump, and the key is how I land, alright? Now you'll see as I land, we want my knees to chase the midline of my foot. We don't want these going inwards or outwards dramatically as we do that. We don't want them shearing forwards. We want to land nice and softly, as quietly as possible without a big heavy thud. Okay, so wearing good appropriate footwear. Sport-specific footwear is better for this. So if you're a basketballer, try to use it in your basketball shoes, or a netballer, etc. And you'll see how we go. So as we land, we take off just a reasonable jump, and it's more about that softness of landing. So we come down nice and soft, and you'll notice there when I landed with my toes first. Knees didn't come inwards and knock together, which puts a dramatic stress and strain on the inside of the knee. So we'll do several of these jumps in order just to train ourselves perfectly. Sometimes we do it in front of a mirror or not, and then basically landing like so, back up, landing like so. Okay, now obviously we can go to a higher level by using the step where we come up onto a higher step, jumping, landing from a greater height. And you'll notice you probably don't hear much of me landing when I do that. Nice and soft. Okay, I'll do a heavier landing this time and do a couple of things wrong, and you'll see what I'm talking about. As we land, bang, thud, knees coming inwards, jars right up through my body, and I can feel every aspect of that. So nice soft landing, and you'll do a number of different repetitions of this depending on what your therapist wants you to do, and then we can add variations to it. So we can do a single leg landing, which is sometimes pertinent for netball, for example, when we jump and we land on one foot. So pick to say I've got a right knee injury, and that's the one that we're targeting, and we're trying to train that knee and rehabilitate it appropriately after doing the other exercises. We'll jump and we'll land on the one, okay? Coming back up, jump, land on the one. As softly as we can, making sure that we're landing really appropriately, not letting the knee go in and out, not shearing forwardly dramatically or jarring through the knee, alright? Now, incorporated in that, we can start to add in some rotational movements, because again, many sports, you don't just land in an ideal environment. So we might have to jump and land and turn 90 degrees. So an example of that is as we jump, turn nicely, landing on the one foot, okay? We can do a two-footed landing, so we might land two-footed in that sideways movement. Any of these types of things that can be quite sport-specific, alright? As we get better, we can then move up into a higher step, which allows us to do more, obviously more impact, a greater level of landing. So that's going to obviously allow us to do more things. So for example, we might jump, turn, land, or we might jump, land, and then take off again to get very specific to our sport, such as a bounding sport, which could be something like triple jump or basketball, or something where we require multiple leaps over very short periods of time. Alright, so again, you might want to land in an unusual angle as you jump and turn and then jump straight back up again. So, or even sometimes jumping, turning and jumping back up onto the box. Alright, so the possibilities are endless, and you can get as creative as you like with these exercises. Your therapist will help you get even more creative and more specific to what your sport needs, and that's going to help us in order to be very, very kind of targeted for what we need to do. Now, the next piece of equipment we had is the BOSU, okay? Now these things are great, not everyone has access to them, but many gyms nowadays tend to have them. So the key with this is learning just to balance on it. So whenever we first get on there, I call it surfing the BOSU. Just get comfortable, just move comfortably side to side, back and forward. Just sort of get used to it, just get your bearings on the actual BOSU, because it is an unstable device. The whole idea of it is to be unstable, so we need to kind of get used to that. Once we get on there, we can do a great little series I call the asterisks. Remember, an asterisk is back and forward, all these different patterns, alright? So the shape of an asterisk, we go forwards and backwards, like so, which does the vertical line of an asterisk. And you might do that 10, 15, 20 times. And then we can go side to side. Again, when we're doing this, trying to keep the knees in a good straight line, making sure that when we go that way, our knee doesn't dive inwards and rotate and twist. We want to keep everything on that perfect kind of chain of movement. And then we go forward and backwards, side to side, and then we do some circle work. So we might go around in circles 10 times that way, which is a combination of all those movements we just did. So you'll do that 10 times, and then you'll go back the other direction, okay? So you've got to do both directions when you do this. And it works quite nicely in terms of controlling that movement. Once you're on the BOSU and you're comfortable, and you've done, you know, the asterisks I use for a lot of people just as a pure warm-up, just to get them, you know, comfortable on the BOSU and just get things sort of going. Then we can start to do some squats on the BOSU. Now, similar to how we do squats on the land, again, this is just going to require a hell of a lot more balance, because obviously, you know, this thing's an unstable device. So as we squat down, trying to keep the weight as evenly through the BOSU as possible, so it doesn't sort of tilt forward and backwards too dramatically. Squatting down with the hands out in front and back up. Squatting down and back up. And as you get fatigued, the legs will start to shake, okay? Which is okay, that's just part of that fatigue process, you know, and you'll find that that will become less and less the more and more comfortable you get with using the BOSU, alright? So there your squats, nice and even. If I sort of turn sideways so that we can sort of see that better with the camera, nice and even like so, squatting down, keeping the back there, nice and even as we come down. Trying to get as low as we can whilst maintaining good form, alright? So from the squat, we can then go on and start to do some single leg balance, or we can start to do some lunges and things like that. So with this one, we pop one foot in the middle. Usually, obviously, we're targeting the leg that requires rehab. So again, if I had a right knee problem, I'd be putting my right foot smack in the middle of the BOSU, standing on it nice and balanced, okay? Just getting used to that single leg balance. Now, again, depending on what injury you have, will depend on what your therapist wants you to do, whether you need to be straight leg or bent leg, okay? But just controlling that movement. And then from there, we can start to move into different positions. So just bringing that leg around the front, bringing it out the side, bringing it back the other side, and starting to draw patterns, okay? Back and forward, okay? You can start writing alphabets, doing all sorts of things, or writing the numbers 1 to 10, whatever you want to do in order to challenge that balance on that leg, okay? So then the next thing that we can start to move towards is doing things like lunges and so forth on the actual BOSU, okay? So we can use it as an extra piece of equipment. You've probably seen people at the gym doing bicep curls whilst they're standing on there, doing, you know, like shoulder press and shoulder raises and things like that. And all of those exercises are good to do on there, but like I said, with the purpose of what we're doing, we're trying to target those lower limbs. So if I was going to do a lunge on there, obviously I stand back like so, just like we can do lunges up onto a step. We can do a lunge where we step onto here and then lunging down and then back up, okay? So we can do that either side, squatting down, lunging and back up. So you can either do a reverse lunge like so, or you can alternate and do more of that sort of Bulgarian type lunge where we step up, step back off, step up, step back off, okay? So just depending, again, very sport specific and very kind of individual on what we need to do with that one, but your therapist will be able to kind of give you a little bit more specific things, but that kind of gives you a bit of the gist of what we're trying to achieve when we do those types of exercises, alright? Then, of course, we can get very sport specific when we use the BOSU. So that can come down to things like soccer, kicking sports, where we can stand on there if we've got a right knee injury, so that when we can practice our kicking movements whilst we're balancing on there, or AFL, we can practice our kicks, okay? Similarly, if we've got someone who might be a tennis player, we want to work on their balance and their control through that. Again, we can practice forehands, serving movements. Golfers, we can practice a golf swing on the BOSU. Anything that you can do kind of on the land generally, you can do on the BOSU itself, okay? So you can notice throughout this, I've been using the platform side. It's called the BOSU for a reason. It stands for both sides up. To progress this exercise, any of these exercises I just showed you, we just turn it over so that we can stand on the dome side. So the dome is a little bit different to the platform side. The platform doesn't want to take you right to the end. It sort of slows you down as you get towards the end of the actual balance. The dome, it doesn't stop you. So it's a little bit slower at the beginning, but as you get towards the end, you can easily fall off. Alright? So all we do is we go back and do all of those exercises again. Like the asterisks, where we're forward and backwards, side to side, circle work all different directions. Okay? And then you can do some squat work on there as well, with a bit closer feet together obviously, but you can see it's a little bit harder to balance, a little bit more trimming required of the foot and ankle in order to control you there. And then we can do some single leg work, some balance work, the lunges like we talked about before, as well as some of the kicking and other sort of sport specific type movements that we need to do. Alright, so it's only limited, I guess, by your creativity. You can use TheraBands, you can be throwing things to each other. Someone can pass you a football or throw a tennis ball at you or a cricket ball or any of those types of things. Anything that's going to help challenge your balance. You can close your eyes, do a number of different things like that. So there's just a sample of some of the more advanced functional exercises that we can do, whether it's using equipment around the house, sporting equipment, or something as specific as a BOSU. So, like I said, your therapist will be able to guide you a little bit closer with exactly what you need to do, and we can go from there. Thanks.